Welcome to this edition of the First Aid Show. One thing we get asked a lot is, how emotionally hard is it to deliver CPR to a child, as the first aider thinks it'd be very emotional and they're not sure if they could do it. We asked a paramedic for their thoughts.
Emergencies with children and babies are rare, but in that event, it is so critical that they get first aid quickly. If the patient, the baby or the child, has stopped breathing, it's so important to call for help. You will be given really, really clear instructions on the phone what to do with the child. You will see signs, they just won't look their normal, nice pink, healthy colour. They will go limp and floppy, and follow the instructions that you're given on your phone. You will not hesitate in that situation. Anybody that is in that situation will instinctively want to help that child. And because children are young and they haven't had decades of smoking, drinking, McDonald's and takeaways and things like that, they generally, unless they were born with a defect, have really good healthy body. So the most common cause of them having this illness is either they are unwell and they have some sort of infection, they may have choked, which has stopped them being able to get oxygen, or there isn't enough oxygen going to the brain for some reason. So as soon as you re-establish their ability to breathe, they will hopefully recover. It's not that they are having a heart attack because they've got older and they've got disease. You can make a huge difference to a child, and you will instinctively follow the instructions you're given and just try as much as you can to do whatever you can to help that child.